Waking up to see bright red blood in the toilet bowl is one of the most terrifying moments of pregnancy. The sharp, tearing pain of a bowel movement or the discovery of a swollen, grape-like lump can trigger instant panic and deep embarrassment. You are not alone, and you have nothing to be ashamed of. These aren't signs of poor hygiene or a failed diet. Hemorrhoids are a mechanical plumbing issue. As pregnancy hormones relax your smooth muscles, your digestion slows down. A heavy uterus pressing on veins returning blood from your lower body causes blood to pool, swelling delicate vessels like overfilled water balloons. To stop the bleeding and the pain, we must address two specific targets: biologically softening the stool to stop the tearing, and mechanically shrinking the pipe to reduce the swelling. This clinical protocol requires 5 specific tools: a 7-inch footstool, a 1-liter water bottle, a plastic sitz bath basin, plain Epsom salt, and soluble fiber. Shifting from passive suffering to this active clinical management allows you to address the mechanical roots of the pain directly and reclaim your physical comfort. Step 1 is the strict fiber protocol. You must consume exactly 25 to 30 grams of soluble fiber every single day. This can be achieved with 2 tablespoons of soaked chia seeds in the morning, a large bowl of ripe papaya in the afternoon, or 2 teaspoons of medical-grade isabgol mixed in water before bed. Soluble fiber acts as a biological sponge inside your gut. It traps and holds water within your intestines, which prevents your colon from over-absorbing moisture and turning waste into hard, dry pellets. While many are told to avoid fruits like papaya to protect the baby, fully ripe papaya is safe and contains enzymes that act as natural laxatives. Avoiding these foods removes the exact fiber and enzymes your paralyzed bowels need to stay mobile. However, fiber only works if you stay hydrated. If you eat 30 grams of fiber but only drink 1 liter of water, that fiber will absorb the little moisture you have left, turning into an immovable concrete block in your gut that makes constipation significantly worse. You must follow the river rule. Drink exactly 3 to 3.5 liters of fluid daily. Keep a 1-liter bottle with you and finish it 3 times a day. Swapping dehydrating coffee for tender coconut water or spiced buttermilk ensures the internal sponge stays wet and moving. Avoid harsh stimulant laxatives like castor oil. Unlike fiber, which softens the stool, castor oil irritates the intestinal lining to force a movement. In a pregnant body, these violent intestinal spasms can trigger actual contractions in the uterus. Achieving this biological softening is the mandatory first step. By turning hard waste into a soft gel, you prevent the sandpaper-like dragging that tears the fragile vessel walls. Once the stool is softened, you must correct your anatomy. Modern sitting toilets are not designed for human pelvic function, as they force you to push around a sharp anatomical corner. At a 90-degree angle, the puborectalis muscle chokes off your rectum like a kink in a garden hose. But placing your feet on a 7-inch footstool relaxes the muscle, straightening the rectum into a vertical slide so gravity can do the work. You must also observe a strict 2-minute evacuation limit. Lingering on the toilet seat for 15 or 20 minutes allows gravity to pull blood into your anal veins, causing them to swell before you even begin to pass stool. Only go to the bathroom when the urge is overwhelming. You can leverage the gastrocolic reflex, the gut's natural urge to empty itself 20 to 30 minutes after a large, warm meal. If nothing happens within 2 minutes, get up, walk around for 10 minutes, and drink warm water. Do not sit and force a movement that isn't ready. Physically straightening the pathway and respecting your body's natural timing eliminates the destructive straining that causes hemorrhoids to prolapse and bleed. To treat the vessels that are already swollen, the 15-minute sitz bath is your most effective clinical tool for stopping pain and reducing inflammation. Place a plastic sitz basin over your toilet seat and fill it with warm water. Dissolve exactly 2 tablespoons of Epsom salt and sit for 15 minutes 3 times a day. The warm water relaxes the painful anal sphincter muscle, while the magnesium in the salt creates an osmotic gradient. This physically draws inflammatory fluid out of the engorged veins, shrinking them rapidly. After the bath, gently pat the area dry. Apply a dual-action ointment containing a local anesthetic to numb the tearing pain and a mild corticosteroid to reduce vascular swelling. Dosage is critical. squeeze exactly a pea-sized amount onto a clean finger and apply it directly to the swollen lump only when the area is clean and relaxed. Do not use steroid-based creams for more than 7 consecutive days. Overuse actually thins the delicate perianal skin, making it more fragile and increasing your risk of future tears. Combining external osmotic fluid extraction with targeted medication rapidly reverses the excruciating swelling of an active hemorrhoid. Executing this routine daily will yield a massive, measurable reduction in pain and bleeding. Most pregnancy hemorrhoids will improve significantly within weeks of delivery once the pelvic pressure is lifted. However, there are 3 medical warning signs that require you to bypass home care and contact your obstetrician immediately. If a soft, painful lump suddenly turns into a rock-hard, dark purple mass the size of a grape, you likely have a thrombosed external hemorrhoid. This is a solid blood clot that requires a minor clinical procedure for instant relief. You must also seek care if bright red blood is pouring continuously into the toilet bowl, or if you experience severe abdominal bloating and vomiting, which can indicate a physical blockage of the intestine by hardened stool. Growing a human being is an immense biological undertaking. By using these targeted clinical tools to manage your bowel mechanics, you ensure you do not have to sacrifice physical comfort during the journey.